Hey everybody, what's going on? Welcome to BFR Tuesday. My name is Cara. I am your host. I'm here to answer any questions BFR related. I'm going to warn you, this week is crazy with Thanksgiving, so this is going to be very short. I have a patient walking in anytime now. I had to squeeze them in before I leave tomorrow for my Thanksgiving. So if there's any questions, please don't hesitate. Throw those questions up and I'll stay on until she arrives. It should be any minute now. So just throw your questions up into the type your message. Right where I threw that hello from Dallas, Texas. Any questions for me? Michael, will push-ups of the bands affect my muscles proximal to the bands? Hi, Lewis. Three different effects that we get. If I have the cuff on the upper extremity, I get distal to the cuff benefits. I get proximal to the cuff benefits, and then I get crossover effect. Some would say systemic effect from hormone changes like growth hormone stimulation, not as much as we once thought. You do get some effect, but not a ton amount. So distal to the cuff, proximal to the cuff. Really, in all application, proximal to the cuff will be shoulder and also glute for your lower extremity, because just proximal. So if you really want to maximize like shoulder, what I would do is do your first exercise as a bicep, do your second exercise as a tricep, and then make your third exercise the shoulder. So pre-fatigue the distal muscles, and then it'll put more emphasis on the proximal muscle here. And you'll also get benefit at the pec as well. Some cool studies looking at increases in pec size, shoulder size, tricep size, bicep size by doing exercises for the upper extremity. So yes, the answer, Michael, is yes, you get proximal and distal effects, primarily with a tertiary effect of crossover or opposite side. But pre-fatiguing the distal tissue will maximize your effects to the proximal tissue. Lewis asks, always pre-fatigue distal muscles to better focus. I mean, if you really want to maximize your shoulder size and strength, then yes, or your glute size and strength, then yes, I would pre-fatigue the distal muscles first. You don't always have to do it, but I mean, I don't know if there's an always with any training. I think you you modify and you go on, but if you really want to maximize your effect, yeah, you can pre-fatigue it with one exercise, each push, pull, and then go more proximal. Yeah, Lewis, so for fatigue, yeah, if you want to do a full set of BFR 30, 15, 15, 15, yeah, no, I would do that. That should fatigue it when you're talking about fatiguing out the distal. So you do 30, 15, 15, bicep curl, 30, 15, 15, 15, tricep extension, and then do some sort of lateral raise or a leaning lateral raise. And if you really want to get fancy, what we talked about a couple weeks ago is when you're focusing on strength, increase the resistance, decrease the pressures. You could flip that if you wanted to just gain size of the shoulder or glute. Then you could pre-fatigue for strength distally, and then go for hypertrophy more proximal by using lighter loads but higher pressures. If you wanted to get fancy, but you don't have to. If just getting in there and fatiguing the tissue, you're going to see a benefit. What else? What else you guys got for me today? This fine pre-Thanksgiving Tuesday. All right, 10 seconds. 9, 8, 7, 6, 5, 4, 3, 2. All right, thank you so much. I'm sorry I have to jump off so quickly. Just have a great Thanksgiving. I appreciate all your support. I will be back next week. And just have a great week and thankful for everything that we got. Bye for now.